Hello and good morning or good afternoon or good night, whatever time you are watching this, to all of our friends across the country. We are super excited today to bring you our second installment of Practice Empowered Policy. Today we're going to talk about empowering kinship families, our manifesto or ideas on the fundamental rights of children living in kinship care. We believe that every child deserves safety, stability, and nurturing care, and that every caregiver should have access to this support. And across our nation, there's a lot of disparities and vast differences in how caregivers can access the support that they need to be able to take care of their kiddos. And so today we're going to explore our manifesto and talk about the essential rights that kiddos in kinship care deserve, and all caregivers should have access to. Let's get to know our speakers. I will start with introductions and then I'll pass it off to Dr. Caliendo. I am so lucky to be able to work alongside all of these women in our mission to supporting kinship families in Nevada and across the United States. I am Leah Dodds. I'm the Strategic Programs Director here at Foster Kinship. I have worked with kinship families in many different capacities over the last 7 years. I now oversee our quality assurance and expansion into other states, as well as the policy work that we do here. As someone whose grandmother was influential and really essential in my upbringing in a grandparent-headed household, in the work that I do with kinship families, I always try to put the perspective of, what if this was my grandmother into all that we do here at Foster Kinship and having our caregivers be supported. And so with that, I'll pass it to Allie.
Hi, so I'm Allie. I'm the founder and executive director of Foster Kinship, and I've been doing kinship work since 2010. And I'm completely passionate about making sure that children in kinship care have access to the resources that they need to thrive and overcome some of what they've experienced in early childhood. So very excited to be able to share some of the learning that we have from our decades of practice here. And like Leah said, I also have some experience as a foster adoptive parent, a kinship caregiver, and just a huge advocate for children who can't live with their parents.
Paula, if you'd like to go next.
Hi, everyone. My name is Paula Ramirez. I'm our Kinship Navigator Program Manager. I've been with Foster Kinship approximately 3 years between an internship and also being a staff member. My background is actually more in addiction treatment. I was previously working with folks who were seeking recovery, and I was doing an internship with Foster Kinship and ultimately just fell in love with the mission and being able to walk alongside caregivers raising children. And so it's really just been a joy and an honor to work here.
And last but not least, Sasha.
Hello, everyone. My name is Sasha Ritchie. I'm a licensed social worker. I'm excited to be in this training. I started my journey at Foster Kinship in officially 2019. Prior to that, I did my internship in 2017. Along my child welfare work, I worked with children in traditional foster care, doing adoption recruitment. And so this is kind of when I learned just how needed kinship caregivers are in when parents can't take care of their kids or when kids can't live with their parents, how important it is to have them stay with their relatives. So I'm looking forward to going through this training with you guys.
Thank you, Sasha. So today on our agenda, we'll give an overview of foster kinship and kinship care in general, kind of talk about what is it, what are the challenges that caregivers and kiddos in kinship care experience. Then we'll get into what are fundamental rights and best practices. Why is it important that we establish them for children living in kinship care? And then we'll get into our thoughts based on our decade of work of what are those rights and what should every kid and caregiver have access to. And then we'll talk a little bit more about our Enhanced Navigator program and how our program tries to ensure these fundamental rights, not only in Nevada, but across the United States for children in care. So as we've said, we're with Foster Kinship. Foster Kinship was established in 2011 as a 501c3 nonprofit, and our whole purpose is to support the 30,000 kids living in kinship care in Nevada. We are the only organization that exclusively serves grandparents and other relatives or family friends that have stepped up to raise their relative or others' kiddos. And we expanded statewide in 2018 and now have served over 10,000 families across the state of Nevada, which is just crazy. When I started, 7, 8 years ago, we had like 600 families in our database. And so there is unfortunately no shortage of kinship families. And so we really try to support all caregivers that we come in contact with and try to identify caregivers in our state to increase their capacity to provide safe, stable, and nurturing homes for the children that are in their care. We have 5 programs that we do this through, and we'll talk a little bit more specifically later about our program, so I'll give a high-level overview. We have our Kinship Navigator program, which is our flagship evidence-based model where we're providing information, referrals, support, and case management to kinship families to help stabilize them. We have Marcy's Heart Resource Center, where we are providing tangible items to caregivers and their children to really meet the immediate needs that they have when they first come into their caregiver's care. We have our Kinship Training Institute, where we're providing pre-service kinship foster parent training, among other trainings that really help manage behavior, address trauma, and teach caregivers about trauma to try to increase, their nurturing capacity for their kiddos. And then we have our Child and Youth Interventions program, which has really evolved over, the last decade of our work from, providing childcare during our classes to not only providing childcare and respite to caregivers, but really helping children increase their social and emotional skills and development and increase coping skills and all of that through our programming in that program. And then last but not least, we have our Kinship Advocacy Network, where we are really helping or looking to harness caregivers and youth's voices and try to make positive policy change with them, alongside them, and for them. And so those are our 5 main programs in which we support kinship families and children in kinship care. And so I mentioned earlier, practice empowered policy. And so our staff, among us, we have over 225 years of combined personal and professional experience. 75% of our staff have lived experience like myself. So many of us have lived this in addition to now working within this sector of social work. And practice empowered policy to us really ensures that the voices of not only our staff who have experienced this, but the families that we serve every day are heard and valued, but also utilized in policy advocacy and implementation. This means including families in our decision-making process before we implement a program. And really all of our programs and the things that we do come from caregivers' needs or our children's needs and gaps within our communities in terms of services. And so we think it's really important to always utilize the practice, especially when we've now worked with 10,000 plus families, and using all of the things that they say and that they need. So with that, I'm going to pass it to Sasha, who is going to give us an overview of what is kinship care and the challenges that caregivers face.
Thank you so much, Leah. So let's get into what exactly is kinship care. So kinship care is a relative or a family-like person. This can include a family friend, a teacher, a godparent who is raising a child full-time and when the child cannot live with their parents. It's very likely that you've also known a relative or a fictive kin caregiver and may not have realized it, because in the US we have over 400,000 children in foster care, while we have 2.7 million in kinship care. And that is about 3% of children in America living in kinship care. So there's quite a bit of children out there living with their relatives or fictive kins. There's really no good reason why children live in kinship care, and often it's the same reason children are in foster care. Informal kinship care is when children live with their relatives or their family friends, just with no formal child welfare involvement or oversight. And it's actually difficult to determine the exact number of children in informal kinship arrangements, but in 2021, Childtrend estimated about 300,000 children lived with a relative in an informal kinship care placement. So there's a lot of children that sometimes are not always accounted for, and we'll discuss some of the challenges next. With kinship caregivers, they face many unique challenges when they're caring for kids who cannot live with their parents. Access to support isn't always consistent within every single state in the United States. And when oversight and supervision from child welfare systems are not provided to informal kinship families, it reduces access to basic needs of financial support, mental health services for children, reunification support. So a pathway back home isn't always overseen, right? Or it may be overseen by the relative. There may be no court-ordered or established sibling visitation as well. So there's no sibling preservation that could be occurring, especially in informal families. Lack of support can lead to lack of ability to provide a safe, stable, nurturing home for children in kinship care. And then what we see is this lack of support can disrupt placements, children raised in poverty, continued unhealthy generational cycles, no pathway for reunification, and that sibling connection that's needed. And what this does in long term is cause public health more crises and more costly price tag later down the pipeline. Next, we'll kind of get into some more specifics of what challenges we see in kinship homes. So we see kinship caregivers and children in kinship care face legal and custodial issues. So this can look like kinship caregivers often face legal challenges related to custody and or guardianship. They may struggle to obtain legal recognition as the child's primary caregiver, which can complicate decisions regarding education, healthcare, and other essential services that the children may need. We sometimes see that a caregiver is also caring for a child or for multiple children for years, with sometimes just a 6 months temporary guardianship because they didn't know how to apply for guardianship within their county or their state. We also see financial strain. Many kinship children, often grandparents, or I'm sorry, many kinship caregivers, but often grandparents or other elderly relatives may be on a fixed income and may not always have the resources to apply for the financial services that they need. They may face social stigma with applying for services for financial ability. And then, of course, like kids are costly, right? And so that stress can be really overwhelming for many grandparents. With grandparents, oftentimes with their fixed incomes, a lot of them have reported while working with us that they, deplete some of their life savings just to meet the basic needs for their children. We also see emotional and psychological stress. The reason for child placement in kinship care can be related to neglect, addictions, sometimes death of the parent. And this can all cause a lot of emotional and psychological stress on the family, including the caregivers. And caregivers may also experience feelings of loss, guilt, frustration, and may not always know how to navigate the complex feelings of grief while also caring for children full time. Access to services and support. Kinship families may have difficulty accessing supportive services that are readily available to traditional foster families. This can include childcare costs, daycare costs, mental health services, educational support, and respite care, reunification services, support for birth parents, and right to sibling connections, aren't always overseen or guaranteed, especially in informal care. Securing proper healthcare and insurance. Some states may count caregiver income to establish healthcare, making access to basic healthcare needs for children difficult to obtain. Or maybe for that state, their healthcare is offered through a managed care through Medicaid, but some of the special services and medical needs and physicians may not be covered that the child really needs access to. We see educational challenges. Children in kinship care may experience disruption in their education due to changes in their living arrangements, due to trauma associated with their circumstances. Caregivers may struggle to navigate the educational system to secure appropriate support for their child's academics. This can look like establishing IEPs or even tutoring services to help their child catch up. We see social isolation. Kinship care feels very isolating because a lot of kinship caregivers who, especially for grandparents, their peers may not be going through the same thing. So getting that connection and that understanding for families can be difficult. And then for children, they may experience that social stigma or difficulty forming peer relationships due to their family situations. Navigating complex systems can be really overwhelming to navigate the child welfare system. Caregivers are often kind of thrust into this world overnight. We see foster parents are trained prior to taking the kids in, but for relative caregivers, often they make a split-second decision or make the decision really quickly to take the child into their home, sometimes with no financial guarantee or support right away. And then, of course, they have limited preparation. They don't always have the tools or education to trauma-informed training until after the child is placed into their home. And then at the same time, they're navigating complex family situation and the strain due to unresolved family conflicts. Balancing personal needs, many kinship caregivers can face their own challenges, their own health challenges. So we see that sometimes with grandparents, especially, they can tend to put their own health at the back burner for the sake of really kind of, focusing on the child's needs at the time. We'll go into some of those fundamental rights for children next. Okay. So when children cannot live with their parents, they should live with their families. You may hear us say this several times throughout this training, but supporting kinship families is really necessary for children to experience safety, love, and familiarity, while also supporting their cultural connections, their self-concept, and their identity. Caregivers without support are likely to be older, single female caregivers such as grandparents on a fixed income, and have limited access to support than of a traditional foster parent. The U.S. Department of Labor reported in 2021 that 2.3 million of children in the U.S. are being raised by their grandmothers, while 1.3 are being raised by their grandfathers. Let's go into the next slide. Because there is no reason for children, there's no good reason for children living in kinship care. Not every state has a foster child bill of rights, so youth in kinship care may not be aware of or educated about what they have right to access to. There are many disparities and lack of resources for children growing up in kinship care that children in foster care have access to. For example, independent living workers for self-efficiency, advocacy services, legal representation, establishing fundamental rights for children in kinship care is very needed and ensures that necessary legal, social, economic protection to thrive in a supportive and nurturing environment for the betterment of their long-term outcomes. Next, I'm going to pass it on to Leah to discuss the fundamental rights and best practices for children living in kinship care.
Thank you, Sasha. So now we'll get into our thoughts on what are these fundamental rights based on the disparities that we see not only in Nevada, but across the nation. So we're going to look at the right to safety and protection, permanency and reunification planning, healthcare, education, financial support, and the right to kinship support services for those families. So we'll start with the right to safety and protection, which I think all of us are going to agree with. Every child has the right to be protected from harm. They have the right to live in an environment free from abuse, neglect, and exploitation, especially when the homes that they came from, right? As we talked about, a lot of our children are living in kinship care for the exact same reasons that children are living in foster care. So our kiddos have the right to be free of that, especially in their kinship home. Every child has the right to proactive measures, ensuring they're not subject to neglect, so neglect prevention, which I really believe this is us as a community need to ensure there are programs and supports in place for families, including parents that are raising their kiddos too, because families need support. And so these supports can look like kinship navigator programs, family resource centers, community centers. All of those things should be available to all families, but especially those living in kinship care. Next is the right to permanency and reunification planning. So every child has the right to a caregiver with legal capacity. Without legal capacity, there's not much that can be accessed for a child living in kinship care. So every child has the right to a legal guardian who can advocate for their rights, needs, and welfare. And caregivers should really be empowered to file for legal guardianship on behalf of the child without requiring expensive legal representation to obtain the guardianship or custody. Because again, without the custody or guardianship, they can't access, medical care, dental care, mental health care, just to name a few. And our caregivers, as we have talked about, are living at or below poverty on a very fixed income. And if they are required to get an attorney to obtain guardianship and cannot represent themselves pro se, then many of our families are not going to be able to afford, attorneys that cost $300, $400, $500 an hour to be able to obtain this. And we do understand that, some legal processes will require an attorney or can make it a lot easier with an attorney, but caregivers should be able to at least attempt it on their own without the process being burdensome, as well in terms of filing fees and difficult service processes. So filing fees, across the nation are very inconsistent. In some areas, it might cost $300 to file a guardianship. Here in Nevada, it's technically free, but there might be filing fees for doing it online. So, it just should be not burdensome or cumbersome for that kinship caregiver to just try to make some legal decisions for their children. Next is access to an attorney. So children in kinship care should have the right to an attorney during this guardianship process, which I'll call like permanency planning process for them. They need somebody that can work in their interest and their best interest. And here in Clark County, we're really lucky that our kiddos do have access to an attorney while going through that guardianship process to be able to speak to what they want. And finally, for this one, permanency planning and reunification support. So we believe every child has the right to permanency planning regardless of child welfare agency involvement. And really what we mean by this is there should be a plan in place that clearly shows parents what needs to be done to be able to get their children back and end the guardianship. What we've seen in a lot of the documents is it's not super clear. It's clear why the guardian to get their children back, which is really important because we want kids to go back with their parents if it's safe and appropriate. We actually don't want kinship care to be a thing because we want parents to raise their children. And so we believe that parents should have clear expectation and a clear guide to what it is that needs to be done. And then community support can kind of pour in to be able to support that process. And really, this just ensures stability and continuity for the child. There's some oversight that, again, just has clear expectations for everybody. Which is really important, especially when you're trying to get your children back or trying to regain, legal capacity over your own child. So with that, I'm going to pass it over to Allie to talk about the rights to healthcare.
Thank you, Leah. So as Leah said, one of the fundamental rights is that children in kinship care are in a home that has legal capacity to make decisions for the child. Often we see that is not established. And so everything that follows that I'm going to discuss is really predicated on a caregiver that can make these decisions. So that is really fundamental for us because we believe that every child in kinship care has a right to health care. So they should have access to the necessary medical, dental, and emergency mental health care that they need. And wherever they're living, that caregiver should have the ability to make some of those decisions for that child so that they're not in a waiting period, or we're not having to track down parents who may not be able to, in the moment, give the right consent for the child to receive proper medical care. So children in kinship care, where the parents are not in the home or not part of that, really deserve to be in a place where they can access health care when they need it. And we believe that Medicaid is a big part of this process. We believe that every child in non-parental care should have access to Medicaid, and that this Medicaid should not be determined based on the income of the parents or the caregivers, or based on the child's involvement with our foster care system or child welfare system. So in some states, all children who are not living with their parents are able to access Medicaid without needing to look at the income of the caregivers, but that is not true in every state. And in those states where Medicaid is only available to children in foster care, and then when they're living outside the foster care system with their relatives, they lose that Medicaid, they lose access to a fundamental right to health care, because so often families cannot afford the insurance, and this is why we see a high number of uninsured children, and to us, this is unacceptable. All children who can't live with their parents deserve access to health care, and we believe that Medicaid is that right option. We also believe that children who are not able to live with their parents have emergency mental health needs that need to be addressed in the moment, and that crisis mental health care is a fundamental right. So they should be able to receive behavioral health, mental health, psychological treatment for anything that is coming up as a result of the need for kinship care or during their non-parental care journey. And so access to the proper mental health care is important. This means that if your Medicaid in your state, if there's different types, as Sasha mentioned, we have a fee-for-service Medicaid, which has more mental health care involved, and then we have these group plans, which it's harder to access. We think all children in non-parental care should have the best form of Medicaid that accesses the most mental health care in their state or jurisdiction. And then let's talk a little bit about education. Every child in non-parental care has a right to immediate school enrollment without delay. And this, in theory, should be covered under the McKinney-Vento Act, where children who are considered homeless still have a right to be enrolled in school. Unfortunately, with kinship care, different jurisdictions and school districts are interpreting this differently. So whereas in foster care, that act applies and children have access to immediate registration and enrollment, in kinship care, it sort of depends on the school district's interpretation of the word homeless. And so some children in kinship care are denied the ability to be enrolled in school in an appropriate time frame, and delaying any sort of educational matters in children who are already going from home to home is incredibly detrimental to their future outcomes. So every child who's not living with their parents and is living in a kinship home has a right to immediate school enrollment. We'd like to see that happen across the board consistently. And then kids in kinship care have a right to educational support. So as we mentioned, families are more likely to be on a fixed income or to be older. And so a lot of times relative caregivers are unable to access the support they need for tutoring or for the technology that children need to thrive in school. And they need a different type of family support so that they can access those things equitably for the children and make sure that their children in their homes are able to meet the standards of their grade level. But also, those of us who live this world and are raising children with additional needs know that a lot of our kids do need and deserve the support of an individualized education plan or an IEP. And without that, school can be a big struggle. So relatives and fictive kin are less likely to be aware of the support offered through an IEP, or there may be some form of stigma involved in saying that your child needs some additional help, and they may be discouraged from going for these resources. But we believe that fundamentally children who are showing some needs in school should have access to an IEP without that being a huge fight for the caregiver, just more of a supportive service. And so if an IEP is necessary, we believe that children have the right to support in accessing that IEP, and that caregivers have the right to know about what services are available. And then finally, they have a right to tutoring and other things to get them up to speed so that they can move forward in their education at least grade level. And I'm going to pass it on, I think, to Paula now for our financial piece.
Okay, thank you, Allie. So the next component that we'll discuss is the right to financial support. So Allie and Sasha have already touched upon this in their portions, but we know that kinship caregivers really need financial assistance. Oftentimes, kinship caregivers are single grandmothers who are living on a fixed income, and so they may already have limited financial support for themselves, which is then compounded by them taking in additional kiddos that they want to keep safe and stable. But we know children cost money and it's very expensive. And so one of the ways that this can be alleviated for kinship caregivers is through different benefit options in their state. One program is called Child Only TANF, and this is disseminated differently in every state, but essentially it's cash assistance that can be made available for children when they are not able to live with their parents and they're being raised by a relative. Each state, the eligibility criteria is different for child only TANF, and then the benefit amount also looks differently. And so this then results in child only TANF being a very complex system for families to navigate. It's complicated for professionals, let alone for families, to try to figure out what services exist and whether or not they're eligible to receive those services. So we would love to see just a less complex system for families to understand how they can receive financial support for the children in their care. Another element to this too is that in many states, families have to agree to a child support requirement, where essentially in order for the caregiver to receive financial assistance through child only TANF, they also have to agree to the possibility of child support for parents. And this can be really difficult for families to make that decision. And so we see that many families actually opt out of receiving assistance through the child only TANF program because it's really hard to circumvent the child support requirement. So removing that altogether would drastically support many families so that they don't have any issues in themselves receiving support and having to make a decision with parents paying child support. The next one is Child Only SNAP. So we would love to see more Child Only SNAP programs throughout the country. Currently, SNAP food benefits are based upon, or in some states, it's based upon the caregiver's income. And so we know that this means that less families are eligible and may not be receiving any food assistance. And another element that can complicate this is that if a family is seeking Child Only TANF and SNAP support, if they then begin to receive child only TANF, their SNAP income may decrease or altogether go away. And so again, just another element that we see that families can get a little bit of help, but then, their food benefits may decrease. So we would love to see children having more rights to food assistance, access to nutritious foods, and sufficient food to really support their health and development. And then lastly is the child care subsidy. So again, this does look different across the nation from state to state and even county to county. And so there may be some programs across the nation where families have easier access to a child care subsidy, but this may also depend on whether or not the child is in foster care, which then just further adds additional complexity to families being able to receive support. For example, here in Clark County, in Nevada, we do have child care, and for children who are in foster care and living with a relative, they can be given priority access to this benefit. However, for the much larger segment of children living in informal kinship care, they don't have any type of priority access. And so there are long wait times. It's based upon their income. And we can see that families don't necessarily get this child care subsidy for quite some time, which, just going back to the full picture of financial support, it's really critical that caregivers who are retired have sufficient access, but also for caregivers who are working, that they are not then forced to reduce their work hours or face additional hardship when caring for children. So then on the next slide, we will start talking about the right to kinship support services. So we believe that every child in kinship care and caregiver has the right to access a navigator program that can provide them these specialized kinship support services. So at its core, a navigator program is really a specialized framework that offers family information, referral, and support, so that a kinship caregiver can contact a navigator program in their area and receive some additional supportive services that are really specialized and tailored to their unique situation. So for our particular navigator program here in Nevada, we provide information, referrals, and support through a helpline where families can call us anywhere in the state and get help in a timely manner and get pointed in the right direction. Some of these families may then be eligible for case management services. And so we're really looking at providing a holistic assessment for the family and reviewing what kind of legal options they have, what financial benefits they may be eligible for, parenting and child needs. So what does this caregiver and the child need to really be successful and meet all of their needs in the community, as well as their mental health and any additional areas that the family is wanting support with. And then lastly is emotional support. So we know that this is really a pivotal element of a navigator program, is that families know that they're not alone, right? Sasha earlier mentioned isolation, and it can be very difficult when a caregiver doesn't have that support network to understand what they're experiencing. And so we believe very strongly in providing that individualized emotional support, but also offering different types of support groups and workshops and family events to really keep our kinship community well connected. And so this is essentially the core of a navigator program, that then really our purpose is increasing safe, stable, nurturing homes for children. However, we also know that these services may target a little bit more at stability. So we have really built out our program to focus more on, again, focusing on the nurturing and safety aspect as well. And so if we go to the next slide, I will review our more holistic framework of how we have really strategically built out our programs to provide families with comprehensive wraparound support. So in the initial green boxes, you can see the core of the navigator program that I touched upon. But just through over a decade of providing our navigator program, we've seen that our navigator program is incredible at stabilizing families. Again, it is evidence-based. We know that it's effective, but we also want to offer families far more than just stability. We want to make sure that they have the long-term skills to really target some of the family system complexities and be able to give them tools for generational healing. So when a family comes to us to access navigator services. Of course, we're going to provide them those intake and case management supports, but we're also going to screen them for all of our other programs. And so if you drop down to Marcy's Heart Resource Center, Leah touched upon each of our programs at the beginning, but just to reiterate, Marcy's Heart really makes sure that families have immediate access to the tangible goods that they need on a daily basis. So this is clothes, shoes, diapers, wipes, car seats, anything that a caregiver might need in that moment to make sure that they can provide a safe home for their kiddos. But we also offer caregiver corner markets, which are a lot more like families coming to just shop in a very hospitable atmosphere. So while we care about giving them immediate tangible support, we also want to offer them a space that can just be a bit more relaxing and comfortable for them to come shop and get whatever they need. And of course, all of the items that we provide are free. And so we're making sure that they have their immediate needs met. And if we drop down to the orange section for our Kinship Training Institute, we're also looking at what potential parenting support do caregivers need to raise children who have experienced some really difficult early life hardships, right? These kiddos have experienced abuse and neglect and related traumas. And we know if that is left unaddressed, those traumas can manifest in some really difficult behaviors as the kiddos age. And so we want to make sure that we're providing caregivers and parents with trauma-informed techniques so that they understand how to best support the kiddos in their home. So we offer training series, individual consultations, behavioral consultations, as well as conferences and resource fairs so that families have everything they need to be a really nurturing parent. Then dropping down to our Child and Youth Interventions program. This is our program that works directly with kiddos, offering a host of different services that are targeted towards a child's developmental age and needs. And so we have programs that are, cub and tots is as young as 3 to 5, all the way up to youth support groups, which are geared towards our older adolescents. So we make sure that we cover this full spectrum for our kiddos. And every single service that we offer is really focused on promoting that kiddo's socio-emotional development. And they also double as respite for caregivers so that when they sign up their kids to come to our office and receive services that are focused on their own coping skills and healing, that is then also time that caregivers have back to themselves to focus on their own needs, which again, we know is really critical for self-care and family preservation. And then lastly, again, Leah touched upon this earlier, is our Kinship Advocacy Network. So all of the 4 programs I mentioned previously are fundamental, and really we're all born from listening to what caregivers tell us that they need. And same with our Kinship Advocacy Network. This is really us offering a platform to elevate families' voices so that they can really direct the conversation and identify, what local, state, and federal policies need to be improved, and how can we really listen to their voices to shape that. So we do have focus groups that are geared towards adults, but we also have focus groups that are for our teenagers to make sure that we're really listening to the full family. So all of that together is really how we have enhanced our Kinship Navigator program to not only make sure families are stabilized, in the present, but also looking forward and making sure that the family has all of the supports that they need to really hit on that generational healing. And to mention again, these services are for caregivers, but also for parents as well, because we want to make sure that the full family is receiving the help that they need. So with that being said, that covers our Enhanced Navigator program. And I just want to thank you all so much for joining this presentation today and just reviewing the fundamental rights that we believe children in kinship care really should have access to on a national level. So thank you all so much, and I hope you all have a wonderful day.